Okay, so this is for SGD 1 and 2 ng neuro. So for the first one, it is about the sensory system. So yung case natin, a 48-year-old male was brought to the emergency room after a motorcycle accident. There was no loss of consciousness, but he sustained bruises in the face and body. So he complained of severe back pain. The vital signs were stable. On neurologic exam, there was weakness in the left leg, numbness on the right leg. And then thoracic MRI results in injury to T7 to T8. So, paano natin masasabi na spinal cord siya? Kasi wala namang sinabi na mas localized yung deficits niya sa left leg and the right leg. Pagka kasi more on sa higher parts, kananwari tulad ng medulla, dapat may loss of consciousness siya. Tapos magkakaroon ng problema dun sa vital signs niya. So based on the findings, what side is affected daw? So left yung sagot kasi if-follow natin yung weakness, hindi yung sensation as stated in the case. So pagka laging tinatanong, so which side yung affected sa mga spinal cords, titignan mo lagi kung anong side yung weak. Tapos yun yung sagot kung anong side yung affected. This one naman sa number 4, jump tayo sa 4. So, do the above sensory and motor symptoms comprise a syndrome? So, if yes, name the syndrome. So, that is your Brown-Séquard syndrome or lesion. So, yung Brown-Séquard, ano siya, pagka isang side lang ng spinal cord yung affected, ang manifestation niya is ipsilateral or same side na weakness. Tapos, contralateral side would be yung problem sa pain, at saka crude touch, tsaka temperature. So yung next naman natin, what sensory deficits are expected from the injury at the level of T7 and T8? So what somatosensory pathways are affected and what are the corresponding deficits? So for the dorsal column, it observes your left position, discriminative touch, and vibration. Tapos, dahil may lesion ng fasciculus gracilis, yun sa T7 na siya, agad mawawala. As compared to your anterior and lateral spinothalamic tract. So here, pinagsama ko na lang sila pero since same lang sila ng pathway, pero magkaiba sila ng function. So right naman yung affected. So crude touch, pain, and temperature with preservation of 2 to 3 segments above and below the lesion. So since T7 siya, ang mawawala would be T9 na. So mamaya makikita siya. And then, dahil sa Lissauer's tract, so important yan. So this table summarizes yung function, tapos yung order neurons niya. So the pyramidal tract, it's not an ascending or sensory tract, kaya naka-red siya. So, yung first order neuron mo, lahat sila dorsal root ganglia. So, lahat kasi sila ng sensations mo, papasok dun sa dorsal root mo. And then, magkakaiba sila sa second order. Second order mo, it would be yung site kung saan sila mag-decussate. So, for the anterior and lateral spinothalamic tract, it would be the substantia gelatinosa on the contralateral side, 2 segments above and below. Tapos, for the dorsal column, it would be the nucleus coniatus for the upper X and nucleus gracilis for the lower X, and it's located sa may medulla mo. And then for the third order neuron, sa thalamus na siya, sa ventroposterolateral portion ng thalamus mo. So that is for the upper X and the lower X and the trunk. Kasi pagka face, medial naman siya ng thalamus mo. So yung thalamus mo, it's your sensory relay station. So lahat ng sensations mo, dadaan dyan sa thalamus mo. Pagka pyramidal tract, it's a descending tract for movement. So galing siya sa frontal cortex, it would decussate at the lower 1/3 of the medulla, and its third order neuron would be the anterior horn cell or your final common pathway. So this one is the posterior column. So again, it observes your position, vibration, and discriminative touch. So yung discriminative touch mo, ito yung mga touch sensations mo na may names. So tulad ng two-point discrimination, graphesthesia, it would be yung kapag ka sinulatan ka sa hand mo, kanwari ng star, you would be able to recognize it as a star. Tapos, stereognosis mo, it would be kapag ka may hinawakan ka na bagay, alam mo yung shape niya. So, kanwari, you're holding a pen, you know it's a pen kasi dahil sa shape niya. As compared sa, sa crude touch mo, ito yung mga sensations na walang name. So, kanwari, may gumapang sa'yo na ipis or may humawi sa'yo na feather, ganun. Yun yung crude touch mo. So, wala siyang name. So, i-trace natin siya. So, first order neuron mo, again, it would be your dorsal root ganglia here. Papasok siya dyan. And then, ascend siya using your fasciculus gracilis. So, gracilis because it's in the lower XT6 and below siya. And then, here sa may medulla mo, it will synapse with your nucleus gracilis na. Fasciculus yung nerve tract and the nucleus here sa medulla na. And it will decussate and it will go to your third order neuron located at the VPL of the thalamus. And then finally, para ma-perceive mo yung sensation sa primary somatosensory area. So again, kunwari, this is your T7. So nagka-lesion ka dyan. Of course, hindi na makakapasok yung sensations mo kahit galing pa yan sa baba. So, pag umakyat siya, ay sira na here. So, hindi na siya makakaakyat pa. So, same side nung lesion siya. So, if this is the left, so left din yung walang sensation na ganyan. So, for the next one naman, it would be your anterior and lateral spinothalamic tracts. So, again, same lang sila halos ng pathway. So, if this is your T7, it will ascend 2 segments above using your Lissauer tract. So, 1, 2, actually 2 to 3, pero here it's 2 segments. And then, pag nandiyan na siya sa 2 na yan, sa second segment na yan, it will decussate sa lamina 2. So, lamina 2 yan. Or your substantia gelatinosa. Tapos, aakyat na siya to your VPL of the thalamus. So, that's your third order neuron. And then, again, sa somatosensory areas mo sa brain. So here, bakit may preservation ng sensation? So let's just trace it. So let's say this is T7. So mapre-preserve yung sa T7 and T8 mo actually. And then mapre-perceive mo pa yung deficits at the T9 level. Kasi 1, 2, and then pagka magde-decussate na siya, ay hindi na siya makaka-decussate, 'di ba? Kasi sira na here. So, hindi na siya makakaakyat. So, ganun din sa other level. So, let's try T10. So, 1, 2, sira na here sa T8. Yan. O kung L1 naman, 1, 2. So, makaka-deposit pa siya on the other side, pero hindi na siya makakaakyat further kasi sira na yung T8 mo. Paano naman kung, wait lang, burahin natin siya. Paano kung ang lesion mo, bakit naman preserve yung sa T8 and T7 mo? Ay, wait lang. So, T8 mo, so this is your left side. This is the right side. So, 1, 2, decussate, then makakaakyat pa siya. Kaya, preserve pa yung segments mo sa T7 and T8. Yan. So, again, ito lang yung summary niya. So, kung bakit T7, mawawala yung sensation mo sa posterior columns dahil sira na nga yung fasciculus mo doon. Tapos, pagka naman yung pain, temperature, crude touch mo, maprepreserve yun dun sa segment na yun. Pero yung nasa kabila naman niya nasa baba niya further yung affected. So for the motor system naman, we have a 59-year-old hyperintensive male who experienced sudden weakness of the left extremities. So sinabi doon na sudden, important siya kasi Usually, pag sudden, may pumatok na blood vessel na yon. When he was examined at the emergency room, he was noted to have slurred speech, left facial asymmetry, and weakness of the left arm and leg. So due to weakness, he wasn't able to walk and grasp objects. So what pathway is affected is the pyramidal tract. Kasi nga, for ano siya, voluntary movements. So for to trace it, let's first start with your motor area or your precentral gyrus. So same lang siya, 'di ba? Sa layer 5 siya. Then it will descend to the internal capsule. Tapos, yan. Sa cerebral peduncle ng midbrain, sa basilar portion ng pons, and then sa medulla, you can see here the decussation. So you have here your red and your blue. So yung blue, ibig sabihin nun, mas madaming fibers. So ibig sabihin, mas madaming fibers yung nagde-decussate on the opposite side sa may medulla. Tapos, yung red naman, they will retain to become your anterior corticospinal tract. So your lateral corticospinal tract, it would be the one that would subserve or would control your upper and lower extremities. Whereas your anterior corticospinal tract, it would control naman your trunk. So more on central region mo. Tapos, same na sila na anterior horn cell, peripheral nerve, and then muscle. Yeah. So, what side is the lesion located, right or left? So, sinabi kanina na yung weakness is yung left extremities mo. So, ibig sabihin nun, yung right yung nagko-control sa kanya. Again, dahil sa decussation no, sa sa may medulla mo. And then, dito naman, sa right facial nucleus would result to weakness of the contralateral side of the face. So, again, pagka facial nucleus yung affected, ano siya, contralateral side siya. Pagka naman facial nerve na yung affected, it would be yung same side. So, tapos ng manifestation mo, pagka yung facial nerve na, it would be yung Bell's palsy. So, ang pinagkaiba niya sa central at saka peripheral or yung Bell's palsy mo, yung central mo is that matataas mo pa yung sa may forehead region mo. Whereas yung sa peripheral mo, yung Bell's palsy mo, hindi mo na matataas yung sa may eyebrows mo. Yan. So, if on further examination, there is weakness in the palatal muscles and the tongue, what neurologic findings are expected? So again, remember natin na yung lesion ng brain is nasa right. So pagka palatal deviation, ano itsura niyan? Diba yung palate mo nasa gitna siya kasi parehas na equal yung pull ng right and left palatal muscles mo. Kaso nga lang, so this is your left and this is your right. Tapos, ang nagko-control sa left side of the palate mo would be the right brain. So, ibig sabihin, manghihina siya, di ba? So, yung pull mo would be towards the right side. Yeah. Kaya, same side siya. So, ang palatandaan ni Doc John would be yung union. So, the palate looks like the letter U. So, yung union, it would be union with the brain. So, kung nasaan yung lesion ng brain mo, andun yung lesion ng palate mo. So, what other manifestations or neurologic signs would be expected if this pathway is affected? Since it is the brain that is affected, it's an upper motor neuron lesion. Pagka naman, at saka, kasama sa upper motor neuron lesion mo would be your spinal cord. So, pag nasira yung cord mo or yung brain mo, it would manifest as an upper motor neuron lesion. So, both of your upper and lower motor neuron lesion would manifest with weakness. So, here, wala kang atrophy. Tapos, fasciculations, wala din. So, sa lower motor yan. Yung fasciculations mo, yung muscle mo, it will look like a bag of worms. So, it's moving on its own. Tapos, reflexes mo, notably your Babinski would be increased. So, yung Babinski mo elicited dun sa foot. Tapos, there is your dorsiflexion of the big toe and then fanning of the smaller toes. And then the tone would also be increased in your upper motor neuron lesions. Kasama na dyan yung spasticity. So, that would be for the last